If you ask any doctor, they'll be forced to admit, whether they like it or not, that humans have never been healthier. It sounds like a really ridiculous thing to say, considering if you read the media, we're constantly afflicted by some kind of epidemic, everything from Alzheimer's to coronavirus to Zika to binge eating. But if you step back and look at things on a civilizational level, everything is improved, from infant mortality to life expectancy to levels of disability. Things never really have been better, physically anyway, for humans, and much of the credit goes to modern medicine. We're very boastful about it. So when the same prideful community warns of an impending apocalypse, it's probably time to listen. So what I'm talking about here is antimicrobial resistance. Now, it's a complex term, but all it basically means is that the bugs that normally cause diseases, bacteria, viruses, funguses, when they become stronger than the drugs designed to kill them, we call that antimicrobial resistance. So the idea is that normally antibiotics will kill a bacteria, but when they are prescribed inappropriately or excessively, that bacteria can evolve in some way into a new strain that is resistant to the powers of that antibiotic, designed to kill it in some way. And ever since the first ever antibiotic invented in 1928, there's this perpetual almost arms race of us inventing an antibiotic, using it, the bug becoming resistant to it, and organisms evolving and modifying and becoming stronger in all these ways. And the point we've now reached is that the WHO, the World Health Organization, is very concerned that we're on the brink of a post-antibiotic era where basically none of our drugs work. So this problem of antimicrobial resistance is driven very much by the overuse or inappropriate use of antimicrobials in healthcare and in agriculture. And the thing that really concerns me as a doctor, particularly as a GP, is that an Australian survey showed that at least half of all GPs would consider prescribing an antibiotic to a patient inappropriately if it meant that they were matching the patient's expectations. Now, really sadly, that's not an uncommon problem globally even. So there's research in the UK and America that backs this up. In fact, there's a great study in the Cleveland Clinic in America that shows that whether or not a physician gets a 5-star rating on Google is highly predicted by whether or not they prescribed antibiotics. So when I think about why doctors prescribe antibiotics unreasonably, inappropriately, it's, yes, about matching patient expectations, but it's also other things as well. Sometimes we're quite irrationally fearful that we don't want to miss a really serious diagnosis by not prescribing the antibiotics, and then the patient gets very sick. It can often be this irrational fear that we have that is not actually in keeping with what we're taught in medical school, but we're fearful, we're worried about patients. Also, there's concerns about not getting sued, and there's also concerns from the patient side, which is that patients have some unrealistic expectations about what an antibiotic can do, often thinking that diseases that are say, for example, the common cold, something caused by a virus that cannot be killed by an antibiotic. Patients, of course, feel entitled to get something to fix their disease. They take an antibiotic. It feels like their visit was worth their while going and paying $40 for the appointment. They get what they want. So I think this is where the problem is going to have to be tackled. For doctors, we need to realign the incentives. At the moment, they're incentivized in every way, legally, interpersonally with the patient in terms of that interaction, financially, to prescribe that antibiotic. We need to realign that incentive the other way, where they need to be incentivized to do the right thing and do the difficult thing, which is withhold giving antibiotics. And for patients, we need to realign their expectations with reality. Both those things that need to happen before we can fix this looming crisis of antimicrobial resistance.